Hi, so welcome. I came across this video online, a video by Jubilee, and it says, "Do miracle healings exist? Doctors versus holistic healers." And I felt it was a very interesting topic, a video that I'm yet to watch it fully. So I'll be sharing my screen and we'll be watching the videos together. Don't go anywhere.
We've all heard the benefits of yoga and meditation. A reset on the mat may be just what the doctor prescribes.
Some people just go, well, whatever the doctor says I've got to do because the doctors know everything. And I don't believe that they do.
Behind the medical celebrities of Deepak Chopra and Dr. Oz is a contentious, decades-long strategy to promote alternative medicine to the American public.
Why did you go into the field?
It was my calling. That's the easiest way I can say it. My journey began over 10 years ago. My world became very dark emotionally, and I came to a point where one of my doctors said if I did not change my emotional state, I was not going to survive more than 2 years.
I've always enjoyed interacting with people, taking care of people. Cancer was one of the diseases that interested me the most.
I wanted to be a person that could heal people's problems.
Herbalism means to use plants as a modality for healing.
I think it's actually somewhat confusing because it could be anything from a health coach that got an online certificate over a weekend to a medical doctor who has extensive training.
I think there are a lot of misconceptions about holistic health involves, and I look forward to being able to kind of enlighten some people today about what it is that we truly do.
My name is Armin Hose. I'm a psychiatrist and podcast producer.
My name is Josh Mansour. I'm a cancer doctor, physician here in Los Angeles.
I'm Sade. I'm a folk herbalist and educator.
My name is Jeremy Stillman, and I'm a hypnotherapist and life coach here in LA.
Interesting.
I'm Christina Ovsepian, and I'm a holistic practitioner, healer, hypnotherapist, and breathwork practitioner.
I'm Shadi Vedat. I'm an internist, hospital doctor, and integrative practitioner in Los Angeles.
Can I have all of my holistic healers on the left, and can I have all my medical professionals on the right?
Interesting.
I have had bad experiences with Western medicine.
Wow.
I was like, come on, you're lying.
I want to say something to that. So as a physician and being in the part of what people deem as quote-unquote Western medicine, there's always going to be a bad apple, and there will always be someone that has a negative experience.
That's true.
That's not to say that the whole thing is negative.
When my son was young, and I didn't want to give him the MMR vaccination, that was my belief that my son was not safe to get that MMR vaccine. And I had to fire my son's pediatrician because she looked at me and she said, if you're not going to trust my professional opinion, you're stupid. And I transferred
that was harsh.
my child to the next doctor, and I said, doctor, what do you think? And she said, don't do anything where your heart is not in the right place to do it.
I'm a Western medicine doctor myself, and most of the negative experiences have come about when I've been a part of on the caregiver side and have taken family to doctors or hospitals. Dealing with hospital staff has been pretty traumatizing, actually. And
Okay, wait. So she's saying what? I don't know what. If she is complaining where she's finding herself, she's complaining, then here in Africa, yeah, she may not survive. Because, well, it's true. There are lots of people that when it comes to the pharmacy and you even have to refer them to the hospital, they just say, no, they are not going to the hospital. They can't go to the hospital. Which is bad. It's not supposed to be. But, well,
the system, knowing what needs to be done, it's very clear to me when things are not done in the right way. And I always wonder if it's so challenging for me as a physician, how would a family know how to advocate for their loved one?
I have had personal experiences and also personally witnessed people in my family and in my community just have outright medical violence enacted upon them. And I'm not just talking about neglect, I'm talking about organs being removed. But as a woman that has a chronic illness, I'm actually in contact with doctors a lot, and I wish I could report that I've had positive experiences, but I can't think of a single doctor I've had that hasn't displayed racial bias in a way that negatively impacted me.
Well, it is true that a lot of people do have negative experiences when it comes to the hospital, but I'm also sure that even though there are still negative experiences, there are quite some people that do have the positive experience, and perhaps it depends on the individual or the physician that they met or the health professional that he met. That people with quite good experiences as well. So, well, I don't know. And definitely there are the negative ones too. There are some really good nurses and well, a lot of people see nurses are bad, but then I think I've met some quite, really good ones as well too.
Love to see an integration, but in the meantime, the culture in Western medicine creates a space that's not safe for me.
And given these bad experiences, I'm curious to ask you as physicians, where do you think the role of the patient lies in terms of, doing our own research?
I tell all my patients to bring as much research as they want, bring as many questions as they want to me. And there are situations that say they want to bring a more holistic type of treatment. It can be integrated.
The one caveat I would say to that is a lot of times when folks that don't have the background training that we have take to the internet, and they start Googling stuff.
Absolutely.
And there's so much misleading stuff out there. While I definitely also encourage research, be cautious about what you read. You can't validate everything that's online.
Yeah, I really agree with him when it comes to that. So there are lots of people that do research. We are not saying research is bad. So I just agree with him because sometimes you can't really validate what you see online. And for most health professionals, we do have certain years that you spend in school, learning, doing lots of research. So definitely they will have more knowledge when it comes to some areas, some diseases. So you can't just use a quick second of online reading, which can help either ways, but then you can't really use that and challenge maybe a health professional, even though sometimes it helps, but then, like he's saying, you can't validate everything you see online.
As a person with a chronic illness, when I come into the doctor's office, sometimes I come as an informed person, and I feel like that's not appreciated. And I've experienced in other countries that medical professionals don't carry quite the same arrogance.
I believe the other side takes advantage of vulnerable people.
What? Well,
Yeah.
interesting.
When you look at the way conventional medicine is practiced, you see heavy amounts of influence on the parts of special interests. And the average person who's sitting down with a physician, they don't know what has led up to that experience of them being prescribed a medication. They're just going on this, this faith that they have that they're going to be taken care of.
I do have a problem with a lot of holistic healers as they continue to grow and how much they are taking advantage of patients. The oversight is very minimal for some of these practitioners who claim to be holistic healers. They're not.
This one I want to comment on because it is true. When you go on Instagram right now, you see lots of people selling a whole lot of things, herbal preparations. I'm not saying all of them are bad, but there are some people you don't even know the ingredients and the things that they present to you as quote unquote medicine or something to help you, your healthy life state. They can't even tell you the ingredients inside. Meanwhile, they are advertising and they are making you drink. I don't know if I would classify that as taking advantage of people. But then if there are lots of money involved and if people are actually getting lots of money from that, then probably it's okay to say that people are taking advantage of people. Maybe I'm a side of what she is saying because definitely a lot of people are doing crazy things of late.
Any rules or regulations, and they are claiming to know everything.
To you.
I think most of the time, if someone has a bad experience with any provider, it's because of the quality of the provider, not necessarily whether they're alternative or
No.
Western conventional medicine.
That's
I
true.
think that there are times when it does come down to what the patient, their condition is.
I have so many people that come to me as kind of a last resort because they weren't able to get what they needed through Western medicine. And sometimes I'm not the first herbalist or alternative practitioner they come to. Sometimes they're wooed by somebody that has a better Instagram page or better marketing. And I call those Instagram healers, not to be dismissive, but because there's a lot of harm that is done by improperly trained holistic healers.
Exactly.
But I don't feel like those people that are taking advantage of those that are sick are the issue. I still believe it's the medical system that has, over time, suppressed alternative traditional healers. And because of the suppression, they've been driven underground, and so now it's harder to find somebody and hold them accountable if they've done wrong.
I think both sides can be quick to dismiss the value of the other side because they just don't understand what's involved. And I feel strongly that really there's a time and place for all of us. But it's on the patient to do their homework, to know what is the background of each practitioner. You have to think what their training is, and maybe you're asking the wrong question.
Yeah.
That's a good one. Before you go anywhere, whether hospital or getting to a holistic healer, quote unquote, whether you're going to do a massage or you're going to get some hairs, know the background of the person. If they have to provide you with a license, let them do that. I mean, it's your health, it's your body, it's your life. So don't joke with it and don't assume that once a person is marketing or has lots of followers online means that they are actually accredited and they know what they are doing. Some people are selling things and they don't even know what is inside, but because of the small money they are getting, they are, advertising and making whole lots of what's the term? Whole lots of fuss, and some of them even make testimonies and get people to testify for them and say whole lots of things that are not true. So please do your research well before you you give your body or you trust your health into someone's hand. Okay.
I support universal health care. Having
Why are they all standing there?
to medicine should be a human right. The United States is known for being a country where you can get anything if you have the right type of money, but we know that's not true because I can think of a number of celebrities with lots of wealth and access that almost died. Not for want of money, but just because of who they were, because of their background. But there are places where there is universal health care and anybody has access to it and they thrive because of it.
Well, it's quite sad that when it came to uh, the universal health care, we didn't have lots of them coming to sit down and talk about it. It's saddening. Yeah, it's saddening. It looks like even though a lot of us want healthcare to be universal, um, there are lots of factors that come into play, money wise, location wise, a whole lot of places, a whole lot of things, factors come into play. There are certain locations that you may not even get more than two pharmacies. Maybe we may be fortunate enough to be in an area where there are multiple pharmacies or multiple hospitals. There are some places that they have to walk several miles before they even get a hospital or even a pharmacy to buy medications from. Healthcare, we all want it to be universal, but definitely, obviously, we have a long way to go. Yeah, we do have a long way to go.
I want to know why you guys don't separate. I have something to say to that. I do completely believe in that, but maybe not in the States, because I feel you get what you pay for here. If you don't pay for it, you're probably not going to get the best care. But in other countries, let me tell you, I believe it.
Yeah, I mean, socialized healthcare systems are not a foreign thing in this.
What does she mean by in other countries? I believe it. Isn't it the same thing? Or, but even if, well, it's quite a controversial topic. There are some people that they may have to do some procedures because of lack of money. People are not doing much about it. There are some situations or incidents that maybe doctors or nurses can, or practitioners can come together and pay for someone's hospital bills, but definitely it can be for everyone. So, like I said, we have a long way to go.
Country, and we have like the Veterans Administration. That's like the largest healthcare system, in the country, and it's essentially a socialized system, universal. I can speak to the level of care being pretty good, but to compare it to something you might get in a Beverly Hills private practice or something like that, it may not be quite the same level.
Yeah.
So in terms of quality, the facilities, the service, and if that's what you want, you're probably not going to get that in a socialized system.
Yeah, I think there's no denying, especially with everyone here, that we would want for everyone to have health care. I mean, it is a right of every person to be able to get treated for it, to help them. That's not the issue. The issue is it takes so many different other moving parts to be able to make that happen. The finances between it, getting payment for hospitals to stay open, employing the nurses, the doctors. This isn't a simple, oh, do we just want every person to have health care? I mean, come on, of course. But there are so many other variables that people don't understand that gets taken into account. I mean, everyone's platform, it seems, every politician goes, oh, we need universal health care for all. Well, if it was that simple, it would be done already.
Yeah.
It's not that simple.
No, it's.
I have witnessed miracle healings.
What does that mean? What does miracle mean?
Is he asking what that means?
Miracles do happen. People do heal miraculously because a belief system changes. And that's what hypnotherapy allows people to experience as a change of a...
I honestly thought she was going to talk about, spiritual things, God healing people, because it does happen. I don't know what she's referring to as hypnotherapy. Is that what she said? Yeah. But then I believe in miracle healings, and I've actually seen some and experienced some before. So yeah, it does exist.
that has been limiting to a change of a belief that is empowering.
Yeah, I think there's also certain situations, all of patients come in that their prognosis statistically, like you all are saying, based on numbers, based on trials, are more grave than others. Sometimes they will be able to respond to that therapy and then end up being this so-called miracle.
You're not allowed to say miracle.
No, it depends on how we're using the word miracle or not.
I've trained in something called functional medicine, which is an approach to medicine looking at the root cause of illness. And I think the reason I enjoy practicing this type of medicine, because a lot of the cases I consider almost as miracles. The typical patient that I see has essentially failed conventional medicine. I've seen patients with MS who failed conventional treatments and started doing yoga and recovered from foot drop. I've seen patients who were completely bald, cut out gluten, and have hair grow back. Had I not trained in this area, I wouldn't have believed it.
Yeah.
Is definitely true. Sometimes it's not always about the medicines and the things that we are taking inside as healing gadgets. Sometimes it's more about the preventive and the additional things that we do, the alternative medicines and treatments that we get, like the meditation, like eating healthily aside, amongst all other things. These are quite necessary.
I've never had someone come to me that was so hopeless that I absolutely didn't have confidence that I'd be able to help them in some way. If they were outside of my scope, they wouldn't be with me. I heard you speaking about, as a functional medical doctor, you deal with people with chronic illnesses and conditions. Those are the people that I tend to work with. And so if their hair grows back or their inflammation reduces, I see that as like a logical conclusion to the treatment.
A key, I guess, ethical principle that we abide by, which is non-maleficence, do no harm. But another one that's really important is autonomy. And that speaks to what you're saying is it's their body, right? It's their experience, and they have to do ultimately what's right for them, what makes them feel, good and healed. It's really got to be an approach that probably integrates both sides.
And I think ultimately that's why we're here today, to come together and not be separated from each other.
Oh
And
yeah.
work together.
This is quite a good video.
You're the most boring group ever.
Okay. So yeah. This is really an interesting video, and I like the fact that in the end they acknowledge that they have to work together. So they're not separated. You're not separated. We are all together. If you want someone to take care of you, whether the person is into the Western type of medicine or the person is finding themselves in the holistic health area, know the background of the person. Make sure that the person is properly trained and get some, evidence and maybe a number of people that the person has helped. In the end, it's all up to you. It's your body, it's your health, it's your life. So do not be forced to do something that you don't feel right about.
So don't forget to hit the subscribe button and also check out some of my videos on this channel.